Dr. Marizel Van Rensburg. How are you? And compliments of the season to you.
Hi, sir. Thank you so much. Yeah, Happy New Year. I'm good, thank you. How are you?
I'm great. It's lovely to catch up with you. I know it's been a couple of months. I don't know how long it's been. And
Yeah.
yeah, it's nice to get you on again. And especially on today's topic, it's quite interesting. The anxiety,
Mm.
stress, and depression and natural mental health options that matter. So to get the ball rolling, how do you define natural mental health and how does it differ from conventional mental health approaches?
Okay, I think that's a very important question. And I think we need to start by understanding how the body works. So the
Okay.
body is created and programmed to be in a state of homeostasis, correct? So if you look at your temperature, if it's too high, the body will do things to bring it low. If your blood pressure is too low, the body will do certain things to get it up high again. So the body loves balance. And we
Mm.
see that in every single aspect of the body. And so the same applies to our mental health. If we look at the human experience, right, which is such a complex thing, we see that people go through highs and lows of life. And that is just natural and it's always going to be there. The problem
Mm-hmm.
comes when someone is in a low and they can't seem to get out of that
Yeah.
it doesn't want to doesn't want to go up again. So yeah, the body knows how to handle itself, and any um, any season of depression or anxiety or stress, it's kind of normal. It's actually healthy to have stress and to feel it
Mm-hmm.
in your body, and the body has certain mechanisms to get over it. But then the problem comes when the body struggles to get over it and is stuck there.
Yeah.
um, so, when we're talking about treatment of mental health, it's important to know that when we look at conventional care, that would be your normal Western medicine, the antidepressants, the anxiolytics, they are very much focused on your symptoms. The symptom
Mm.
presents, so let's give it something to push that symptom down. Um, Whereas homeopathy, which is only one of the natural mental health options that a person has, homeopathy is um, gives you individualized treatment and it looks at you, the person as a whole, and it treats the person and not the symptoms. Um, because your body is in a state of dis-ease, right? So no symptom is just merely by itself. The body has a whole communicating mechanism saying, hey, I need help here, I'm stuck there. So homeopathy looks at the root cause. Um, and then obviously there's other natural mental health um, options, such as your herbalism, your phytotherapy, so many other different best therapy or obviously I love my psychology, going to a counselor, all very, very important. So yeah, there's a whole lot of options when it comes to helping your mental health naturally.
Wow. What are some of the most common mental health challenges you see today, and which natural interventions have shown the most consistent results?
Awesome. Yeah. I
Hmm.
think in today's world, we see a lot of mental health concerns, such as just your daily, everyday stress,
Okay.
anxiety, depression. I also see a lot of burnout. The lives we're living causes a lot of burnout, as well as brain fog or inability to focus or concentrate. It also, mental health many times shows up in our sleep patterns, and someone struggles with
Oh.
sleeplessness. Yeah, I've also seen and treated some patients with OCD, your
Hmm.
schizophrenia, even the patients at the beginning of their Alzheimer's or dementia journey. Yeah, I think there's so many different mental health issues, and you do see them all today. Specifically the stress, anxiety, depression, burnout, like I said. Um, Yeah, and I think when it comes to what provides the best results, I, in my practice, have seen that individualized homeopathic treatment works the best. Homeopathy, there's kind of like two thought processes. You can either treat the symptoms, that's more of
Hmm.
your conventional Western medicine, like we talk. You see the symptom, you treat the symptom, whereas classical homeopathy treats the person, the whole individual. And I feel like that individual classical homeopathic approach provides the best results because, like I said before, we're a whole person, a whole being, and our systems are not separate. I've also seen that your adaptogenic herbs helps a lot.
Hmm.
So this is more on the herbalism side of natural health. Your ashwagandha, your St. John's wort, your withania, they all have so much benefits and definitely can help someone who's going through a bit of a rough time. Yeah, then there's also your other supplementations like your vitamins and minerals and your magnesium to help just calm and support the nervous system. They help terrifically.
Wow. All right, I have a question for you in the comments. Are you okay if I actually ask it to you now?
Yes, true. Yeah,
Sure.
go
All
ahead.
right. This is from Jitin Rishika. Hi, Dr. Marizel. Thank you for a beautiful pod. What is the best remedy would you recommend for sleep apnea?
Yeah, so with sleep apnea, that's quite a difficult thing because there's also some anatomical changes, physiological changes that needs to be considered. Um, like I said, in homeopathy, it's very difficult to just say, okay, this one remedy is for sleep apnea alone, because when we look at our remedies, it addresses the whole person. So yeah, I would definitely with sleep apnea, there's a few remedies that I can think
Hmm.
um, off the bat that goes along with your sleeplessness and has to do with the nasal sinuses. But these specific homeopathic remedies, obviously, you won't find over the counter. So it is something that you need advice from a qualified and registered homeopath. Um, the same applies when it comes to the herbs and the herbal things that you choose because the herbs, and we'll talk about that a bit later, not all herbal natural products is um, the same quality. So you'll
Yeah.
find that some advertise as, oh, this is going to help you with this, this, and that, but then the quality isn't what it should be and it doesn't help you with that. So I would always recommend getting that personalized advice rather than just buying something, wasting your money, and then it not helping, especially with something like sleep apnea that has a, a deeper like I said, anatomical and physiological cause.
Oh, so you wouldn't be able to mention that herb for the sleep apnea off the cuff now.
Like I said, there's a lot of them, and it
Oh,
depends
okay,
on
okay,
person to
okay.
person. Yeah.
All right. How do nutrition and gut health influence mental well-being, and what simple dietary changes can people start with?
Yeah, I think it's really important, and more people are realizing the importance of gut health. We are finding more and more studies linking the brain and the gut, and this is a two-way communication. We call this the gut-brain axis,
Okay.
and we usually always thought that it was the vagus nerve and the vagus nerve alone, which it is. The vagus nerve from the brain goes to the gut and affects the gut. But we also
Hmm.
now know that we have, I don't know how many billions of good bacteria, good microorganisms in our guts that does things for us that our body can't do alone. Um, which includes breaking down certain foods that we can't and providing us that beneficial products by breaking down the food. Yeah, so that gut bacteria has such an important role on our mental health, especially when it comes to like something like leaky gut. Is this term that a lot of people have heard of? Leaky guts just basically when the closings in the gut lining doesn't close properly. So what happens is you have things in the gut moving into the bloodstream where it's not supposed to, and it moves into the system, and then it causes inflammation in the gut, and that
Mhm.
inflammation goes throughout to the whole body, and then you end up with something like brain fog. So yeah, like I said, the gut and the brain is a two-way communication. So we find sometimes people with mental health issues have issues with their gut. So someone with anxiety or anticipation might have a bit of diarrhea. Um, and then you also find that someone with who is a bit anxious might have stomach cramps, or especially your kiddies who are being bullied at school. Many times they would say, "Oh, I don't want to go to school. My tummy hurts," which is very real. Their tummy is hurting, but it is
Yeah.
because they're anticipating that bullying at school.
Mm.
So we know that the mental health affects the gut, but now we also know that the gut affects our mental health. So people with imbalanced gut microbiome actually is more likely to struggle with all of these mental health concerns. Yeah, so how would you change that, or how would you improve your gut health with dietary changes? I always
Mm.
tell my patients that they need to eat the rainbow. Um, Eat as much fruits and vegetables as you possibly
Mm.
can. I always say a good measure is half of your plate needs to be fruits or vegetables, non-starchy, preferably. But then you can
Mhm.
also include things like your fermented foods, kefir, sauerkraut, your kombucha. They all help to put good bacteria back into your gut. And then also just avoiding ultra processed sugars,
Mm.
because not only does it affect your gut microbiome, but those crashes help contributes to mood swings, which is obviously not preferable with someone who's already struggling with their mental health. And then also increasing your omega-3 fatty acids. Those are really nice. Your flax seeds, your walnuts, your oily fish,
Mhm.
they're all good for brain health. As well as your vitamin D3, I think sometimes gets overlooked, but vitamin D3 is often low in many people without them knowing it, and it has such a big effect on the overall body, but also mental health.
Wow. Can you explain the role of lifestyle factors such as sleep, movement, and sunlight in supporting mental health naturally?
Yeah, so I've talked a bit about dietary changes, but all these things, your sleep, movement, sunlight is so, so important. Obviously, if you don't sleep well, it's going to number one affect your mental health, but it
Yeah.
also affects that gut microbiome. I also see that not only does sleep affect your mental health, but your mental health also affect your sleep. So usually it's a vicious cycle, and
Mm.
some people struggle to get out of it. But many times I feel like the biggest concern is just sleep hygiene, making sure that you have your consistent sleep schedule, that you have a digital detox at least 1 hour before bed, and that you keep yourself off of your phone. I think is the biggest concern for most patients. Movement is also very, very important. We know that movement has so many good benefits, including releasing endorphins. Endorphins is your feel good hormones. So
Okay.
when you are exercising, you're literally giving yourself a little happy boost. And I know many times it doesn't feel like that at the time,
Mhm.
but over consistent exercising, obviously exercising that your body can maintain to work it up slowly. If you haven't exercised in a while, you'll definitely start feeling the benefits, and you'll find that you'll crave the exercise and the movement because it actually makes you feel so good. Sunlight is also very, very important. I think in today's age where everyone is so afraid of skin cancer, and our working conditions where we stay in a um, indoors the whole day, we don't
Mm.
get enough vitamin D3. And that's why I said a lot of people are deficient in vitamin D3. And sunlight is basically cheap, it's free vitamin D3. So you go out in the sun, 10 to 15 minutes a day already will make such a big difference. And you'd feel it in your mental health.
That's true. What natural therapies or supplements are often misunderstood or misused when it comes to mental health?
Yes. Okay. I think the biggest one is St. John's wort. I know that a lot of GPs are very skeptical of St. John's wort, and they have all the reason to be, because St. John's wort is a herb that helps with depression mainly and helping you feel better, and it's almost like the natural Prozac. But St. John's wort has a lot of drug interactions. So
Oh.
anyone who gets the advice from, online, oh, take St. John wort, just be careful if you're on any other medications, because it
Mm.
does interact with a lot of your conventional medicine. So yeah, obviously St. John's wort is lovely, but take it only if you're not on anything else, or if it's recommended by your natural healthcare practitioner. And then, like I mentioned, not all herbs are equal. So yes, we love our natural remedies, but unfortunately, there's companies who try to push profit over quality
Yeah.
of herbs, and then we end up with all these cheap options on the shelves that we tend to grab, but they're
Mhm.
not going to produce the desired effect, or won't even meet
Mm.
the studies that were done about that herb. So yeah, it's important to know the brand that you're buying. Then another misunderstood concept is the thing versus the homeopathy versus herbalism. So like I said, I'm a
Yeah.
homeopath,
Mhm.
and our remedies are made from natural products, your herbs, your minerals, your animal kingdom as well. The herbalism, or phytotherapy, that is mostly just your plants, and it's the plants diluted into a liquid form. They call it a mother tincture, and you take it and it tastes bitter, but that plant, that herb, has a chemical effect in the body, just like any of your other Western drugs would have. So it's important to understand that that treats a symptom and it has a chemical effect. Homeopathy takes that herb and it dilutes it a little bit further. So what ends up happening is you have a dilution, so the product decreases, but the energy increases as you dilute it. So what happens is you end up with a natural remedy that is very gentle yet powerfully energetic. So homeopathy is energetic medicines that acts on your body's energy to heal
Mm.
itself. So it doesn't have a direct chemical effect. And because of this, because homeopathy is an energy and not a chemical effect, you homeopathy can be taken safely with your conventional care. So all my patients on their antidepressants, their anxiolytics, their blood pressure and glucose remedies, they all can be taken safely with homeopathy. Homeopathy wouldn't have interaction. And I find that this is misunderstood a lot under the Western um, medical professionals. They classify homeopathy as a natural thing, so stay away because it interacts like St. John's wort. Some things do interact, but these homeopathic things wouldn't. So it's important to just have that in mind and know that you can take both. And I often like my patients to take both because the Western antidepressant helps them in the here and now, which is the urgency, whereas the homeopathy goes down and finds the root of it and treats the person to try and get rid of it so that they hopefully can get off of the antidepressant.
Right. For someone struggling with anxiety or mild depression, what natural strategies can be safely explored, before or alongside medication?
Yes. So, if you're someone who struggles with your mental health, with your mental health, and you
Hmm.
need some help, the first place where you can start is your diet. Like I mentioned, more fruits, more vegetables. Eat the rainbow. Include your sauerkraut, your kombucha to feed the gut bacteria. I would also drink more water. Very few people drink enough water, at least 2 liters a day. And then also do the exercise, because the exercise is going to actually help you feel good. Sunlight, like we said, and try and get yourself into a healthy sleeping habit. That digital detox before bed is so important. If you've done all these things, I also suggest maybe some vagus nerve stimulation. So to have your deep diaphragmatic breathing, that belly breathing where you actually feel the belly coming up and down. I think a lot of people breathe very shallowly, but our
Mm.
lungs have huge capacity and we need to fill them up and deflate them all the way. And that would actually have a great impact on our mental health. Another thing would be, which is also to do with the vagus nerve, is it's silly, but you immerse your face in cold water. It's this cold water face immersion actually uh, affects the vagus nerve and helps to reset and release all the good hormones. I also suggest journaling to my patients. Journaling is such an important thing to do because it also helps us work through things. Because mental health, yes, is a physical complaint, but it is an emotional thing that has to do with you doing the mental work, understanding yourself, why you react in a certain way in certain conditions. And then, yeah, if you've done all these things and they haven't been helping, I would definitely um, suggest going the natural way first before your Western medication. I feel like the Western medication has its place and is definitely helpful in situations of emergency. But I feel like natural health can do so much for you, especially in that first start of the disease or the mental health concerns. Your phytotherapy or your homeopathy has such an amazing effect on the body.
How important is emotional processing and mindset work in healing mental health challenges naturally?
I love this question, Sid,
Mhm.
because it is so important. Um, like I mentioned before, the journaling, it's so important to understand yourself. Whenever I have my patients, I explain to them that our mind is a garden, and the good flowers in the garden is the good positive thoughts, and then you get the negative thoughts, who that is the weeds in the garden. So you end up with a lot of weeds in your garden and life just seems miserable, and that is mainly maybe because of genetics or because of the season of life that you're in, or some lifestyle bad habits that has caused these weeds to really build up in your mind, right? Um, and homeopathy or even phytotherapy, herbalism, and I would even argue your Western medication with your antidepressants, they won't help you get rid of the weeds in the garden. All they do is get your body in a stage where you have enough energy now to take the weeds out yourself. Yes, I understand mental health is such a difficult thing, and it's easy to say,
Mm.
okay, look on the bright side. But when you're in that space, it's physically impossible. And it really is such a dark space that you can't even bring yourself to do that. You can't even bring yourself to eat. What about like eat the right things? And what about you
Mm.
can't bring yourself to get out of bed? So what about like exercising, you know? It's when you're in a state like that, that's when you need medical help. That natural help will only improve your energy so that you will be able to take care of the weeds. So emotional processing and your mindset is so important. Maybe not always easy at the start of a very deep pit, but it is important if you ever want to get out of that. And I also think it's important for your daily rituals, just staying healthy mentally. We all need to be doing this. Um, in homeopathy, we believe that suppressed emotions, if you don't feel your emotions, it often presents as a physical symptom or even deeper mental pathology. So if you don't work through those emotions, it's going to show up in your heart, in your lungs, in your stomach. So it definitely is important to go through it. It's important to move your mindset from being a victim to being
Mhm.
an active participant in your mental health journey. My patients can sit here in front of me, but they know that even though I'm the doctor, they're the one who's going to make themselves
Mhm.
feel better. They need to be an active
Yeah,
participant in their healing journey. So, yeah, mindset and emotional processing is
yeah,
everything.
true. Uh, are there warning signs that indicate when natural approaches alone may not be enough and professional medical intervention is necessary?
Yes. For anyone at home who might be questioning whether or not they need help, usually when you ask yourself this, it means that you do need some help. And if you did the lifestyle changes and it didn't help, if you have any thoughts of suicide or if this mental health is severely impacting your life, if you've taken natural remedies and it doesn't seem to help, many times that's the time when you need to go ask for help, professional help, either from a natural health practitioner or from a psychologist or a counselor or a normal GP. And this is so important. It's um, it's good that I mention also that homeopaths specifically are fully trained and we know what are the red flags in any situation. So if a patient comes to me and I see, hey, this is a bit far off and I'm not sure that I'll be able to help this patient effectively, then I do refer. And it's so important that happens if you go to a professional and they want to treat you, is to that they would put your safety first. And safety is first. So whenever there's any, like I said, suicidal intent, especially if it's very strong, always refer, as well as any psychosis where there's a loss of touch with reality, like your hallucinations or your delusions. Always refer, as well as if it has a big impact on your ability to function on a day-to-day basis, like eating and bathing and stuff like that. It's always important to have an integrated approach. And that's where homeopaths fit in, I feel, as well, with other GPs and with your psychologists. And we all work together for the good of the patient.
All right. How can individuals create a sustainable daily routine that supports long-term mental and emotional resilience?
I think the
Mhm.
bookend method is a good idea
Okay.
to make it consistent. The bookend method means that the first few minutes of your day and the last few minutes of your day, you are practicing mindfulness. So,
Okay.
whether that is starting with a 10-minute mindfulness, sitting in the sunlight, journaling, just getting yourself ready for the day, nice and slow, and then at the end of the day to at least do 1 hour digital detox, to read your books, to do your journaling, to eat your food without looking at a screen. It's also important just to start and close your day by being mindful. And if you do that on a daily basis, it has a huge effect. And I always say that consistency is more important than intensity. So small daily habits will build more resilience, instead of just going to a wellness retreat for a week or a few weeks. and then having intense mental health help. Um, I mean, that obviously has its place, but small daily habits is how you actually prevent your mental health from getting to a space where you need intensive care. Like I said, journaling is important. Talking to your friends, family members, counselors is important. We shouldn't be bottling up our emotions. And I feel like a
Hmm.
lot of people go through life feeling alone, feeling like they shouldn't be feeling what they're feeling, and therefore they suppress it, or it's out of
Hmm.
shame or whatever, and they never talk about it. And it's so
Yeah.
important to have that emotional outlet.
All right. Finally, what advice would you give to someone who feels overwhelmed and doesn't know where to start on their natural mental health journey?
Awesome.
Mhm.
When you're in that state, it's very difficult to do anything. So I suggest just starting with one small thing. Don't go into overdrive and do everything all at once because you will burn out yourself in that way too.
Yeah.
So start with one small thing, whether it's like getting enough water in,
Mhm.
keeping hydrated, or just going for a 10-minute walk. It all is such small things, but it helps to start because the difficulty is always in starting, isn't it? So start with that one small thing, something that's manageable for you. And I also feel like seeking professional guidance is important. Like I mentioned before, yes, do all the natural changes, the lifestyle changes that I mentioned, but having someone by your side that helps to give you a personalized roadmap to how you can get from point A to point B is so important. Like I said, because of the herbs, they're not all equal. So having personalized advice on that already is so super helpful. Having someone to talk to actually share your feelings with, it's so important. So professional guidance is always my go-to, and I'd rather go earlier than later because the best help comes when the disease is in its early process. So yeah, so start with one small thing, start doing the daily changes, being more mindful, changing your lifestyle, but know that there is a space and where natural health can help.
So it comes down to that famous saying, prevention is better than cure, something like that.
Exactly, exactly.
All right. All I got to say is thank you so much for your time and insights and look forward to the next one in the future.
Awesome. Thank you, Sid. Thank you so much for this opportunity. Have a good day.
You too.
Thank you.